Good evening, everyone. I'm Dr. Michelle Ramirez from Huxor Pharmaceuticals, and thank you for having me here tonight. Tonight, you're about to discover a new way of understanding what pharmaceuticals can do for the world. But first, I'd like you to take a moment, about 10 seconds, to close your eyes and relax. Imagine a world where happiness and unity prevail, where disease is virtually non-existent, where well-being abounds on the planet. What does this world look like to you? Now open your eyes. This is the vision of Huxor Pharmaceuticals. At Huxor, we strive towards building a future of complete wellness for everyone on the planet. And we aim towards making this a reality now, in the 21st century. Huxor began its journey in the mid-1990s, partnering with Pfizer and Roche Pharmaceuticals to develop leading-edge treatments for obesity and Alzheimer's disease. In 2005, Huxor partnered with Erdman Pharmaceuticals to develop a new line of medications that address the needs of contemporary society. Let's take a look at some of these medications. Ethnovox. Change your ethnicity or race in only 5 days. Patriotech, especially during wartime. Jezerex brings you closer to Jesus, and Homatrol takes you straight ahead. Let's take a closer look at some of these medications. Patriotech.
When you suffer from lack of patriotism, nothing is more important than getting effective treatment, especially during wartime. Patriotech is a prescription medication that's been proven to treat symptoms of unpatriotic thoughts and behavior. Patriotech is not for everyone. Do not use Patriotech if you are not a legal resident of the United States. If you are pregnant or breastfeeding, make sure you tell your doctor. You should talk to your doctor about your political history and any other prescriptions you are taking. The most common frequently reported side effects are headache, indigestion, loss of memory, and uncontrollable urges to wear nothing but the American flag in public. Patriotech may uncommonly cause vision changes, such as seeing red, white, and blue, or not being able to tell the difference between reality and hallucinatory visions.
It feels good to wave the flag again!
Ask your doctor about Patriotech today.
Amazing. Just look at what Patriotech can do for you. Let's take a look at Jezerex.
Sometimes you just need to feel closer to Jesus.
When regular prayer and Bible study aren't enough, adding Jezerex can increase your level of faith from 30 to 70%. Jezerex is a different way to treat symptoms of weakening faith or non-existent faith in Jesus Christ. It is the only pro-faith medication that blocks atheist stenocytes, an underlying cause of weakening or non-existent faith. Jezerex is not for everyone, including people with epilepsy, leprosy, severe acne, or liver problems. There is a risk of seizure with Jezerex. Anyone taking Jezerex should call their doctor right away if they have unusual changes in their breathing patterns or if they experience stigmata wounds on the hands or feet. Pro-faith medications increase the chance of these symptoms in children and teens.
Jezerex has brought our family closer together.
Ask your doctor about once-a-day Jezerex.
In 2010, Huxor partnered with European biotech firms to develop new technologies in cognitive enhancement and also speech therapy. A few years later, Haksor and its partners released Phynexia, the first medication to help people learn the Finnish language. Here's how it works.
Phynexia is the first medication to help people learn the Finnish language. Phynexia offers a unique combination of cognitive enhancement, anxiety reduction, and speech therapy all in one medication. Phynexia can start to work within just 24 hours of the first dosage. Phynexia works by activating the areas of the brain responsible for cognition, memory, and speech. The primary agent in Phynexia is an alpha-7 nicotine acetylcholine receptor agonist. This type of agonist has been found to enhance cognitive abilities by modulating postsynaptic alpha-7 receptors in the brain. Stimulation of the receptor increases calcium permeability and thereby the firing rate of stimulated neurons. Learn Finnish faster with Phynexia. Ask your pharmacist about Phynexia today.
These are 21st century pharmaceuticals. This is Haksor. And I'm not really Dr. Michelle Ramirez. I'm actually Lisa Erdman, a doctoral candidate in the art department at Aalto University. And what you've witnessed tonight is a performative element of my arts-based research that uses interventions in public space to promote dialogue about social issues such as identity, consumerism, and cultural integration. The fictitious pharmaceutical ads that you see here are meant to be a humorous platform from which to bring these topics to the table. They also serve, on a secondary level, as a satirical commentary about over-medicalization and our increasing dependency on pill-based treatments for human ailments. In 2012, the primary media production of my doctoral research, Phynexia, was presented in the Helsinki railway station over the course of 3 days as an art intervention in which the public audience was asked to come and share their stories about living in Finland and learning the Finnish language. The Phynexia event blurred the boundaries between fact and fiction, between public and private, and it aimed at challenging people's assumptions about advertising and the potential of medicine. For more information about Phynexia, go to phynexia.fi or contact me at lisa.erdman@aalto.fi. Thank you. Actually, I'm going to need that wig back. Sorry, but you can wear it right now if you want to, if you feel the urge.
Kiitos Lisa. Näyttää, että Phynexia toimii. Kysymyksiä?
Joo, hyvä. Hyvin tehty.
No, seriously, any questions? No one? Seriously? There? Yes.
To determine that percentage of people who seem to truly believe that this drug was real, actually it's hard to tell because you're dealing with a human factor, and it's everyone expresses that belief or disbelief in different ways. But we estimate, based on what we experienced over 3 days, between myself and the performers, that there were about 15%. One person estimated 20%. Gauging from people's responses that they believed this was true. And some people went to the pharmacy to ask for the medicine, which actually triggered a legal complaint from the Finnish Medicines Agency. And that legal complaint, the legal statement, has become the basis, the theoretical entry point for my dissertation, which I'm now writing.
Nice. Thanks, Lisa.
Okay, thanks.